Rhinoplasty. Introduction. Rhinoplasty surgery is only used to improve the appearance of the nose. Select true or false. Correct. Rhinoplasty can improve both the appearance and function of the nose. To prepare for surgery, you should do which of the following? Choose one of the following options. 1. Discuss your expectations for the surgery. 2. Tell your surgeon which medications you are taking. 3. Quit smoking. 4. All of the above. Correct. Your surgeon will give you more specific instructions on how to prepare for your surgery. Instructions may include what and when to eat or drink and which medications to take. Are strokes and heart attacks common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe, but the older you are and the more medical problems you have, the higher the risks. Tell your anesthesiologist about any medical problems you have had in the past, such as strokes and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are dangerous even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Rarely, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, as well as bleeding and scarring, may happen. Complications from rhinoplasty may create the need for more surgery. Select true or false. Correct. More surgery may be needed if certain complications from rhinoplasty happen. Thank you for using Explain.